Can you introduce yourself with your name, designation, and region of training, please?
My name is Ramiz Elmowafy. I'm a ST6 Rehabilitation Medicine trainee. I'm working in London.
How did you hear about PRM as a medical specialty?
It's a very funny story. I wanted to apply for stroke medicine, and I didn't have a chance to go through the internal medicine or neurology. I applied for rehabilitation because it will get me an access to stroke medicine. But actually, after I did it, I liked it, and now I'm working in rehab. I don't have any plans to go back to work with a stroke team.
Why did you choose to train in this region?
Actually, London has a lot of diversity in terms of teams and also the hospitals, and so they are national uh, center of excellences and different subspecialties.
One piece of advice for a new trainee starting in London.
Uh, I think speak to the team who were doing the rotations before. The other thing, if you have uh, certain uh, like ideas or something, to speak to the TBD at the beginning and try to explore the best place to start in.
Which clinical skills are most important to develop early in the training?
I think the communication skills is the most important in rehabilitation, and the interpersonal skills as well. The other things is try to see what's the strength point and what's the weak points. So if you are strong in orthopedic, just try to read about neurology. If you are very good in neurology, just try to read about MSK and pain and different aspects before starting the training.
What misconceptions did you have about PRM training before starting the training?
I thought it's just neurology rehabilitation, but once I did it, I found that there's a trauma rehabilitation. There's also some other specialties like prosthetic rehabilitation and MSK, chronic pain, and a very wide field to go through.
If you could do your training, if you could redo your training, what would you do differently?
Uh, I would study I would compare my curriculum with the European and Americans and Canadian curriculums. I will try to train myself on the maybe procedures more. The other things I would do is try to focus on the basic as a beginning and then try to be hyper specialized at the end of the training.
Perfect, thank you.